Is China losing control of the coronavirus outbreak? The number of cases in the epicenter rises sharply, and Communist Party leaders handling the response have been sacked. Is a change of strategy needed? This is Inside Story. Hello there and welcome to the programme. I'm Nick Clark. China's president is admitting shortfalls in the response to the coronavirus outbreak. And Xi Jinping is promising to fix problems and loopholes in the health system. Solutions cannot come too soon. Nearly 65,000 coronavirus. Is China losing control of the coronavirus outbreak? The number of Is China losing control of the coronavirus outbreak? The number of cases in the epicenter rises sharply, and Communist Party leaders handling the response have been sacked. Is a change of strategy needed? This is Inside Story. Hello and welcome to the programme. I'm Nick Clark. China's president is admitting shortfalls in the response to the coronavirus outbreak. And Xi Jinping is promising to fix problems and loopholes in the health system. Solutions cannot come too soon. Nearly 65,000 coronavirus cases are recorded worldwide, 99% of them in China. The epicenter of the outbreak, that's Hubei province, reported a sharp increase in new cases. But the World Health Organization says that's because doctors are using a broader definition to diagnose the infected. Hubei's Communist Party chief is among 4 local leaders to be sacked. Tens of millions of Chinese are running out of food and patience. 80 cities have been in lockdown for a month, leaving everyone trapped at home. As Katrina Yu now reports.
Empty streets and an increasingly empty fridge. There are plenty of vegetables, but not much meat for the Wang family's next meal during the coronavirus lockdown. Speaking via video call from Hubei, Wang Xin told us his family was doing its best not to panic.
When we get home, we spray disinfection liquid all over our bodies. When we go out, we wear masks. We don't know if we go out, we come back with a virus stuck on our clothes, so we disinfect every day.
He lives in Jingmen, a city neighboring Wuhan, the epicenter of the virus outbreak. For 3 weeks, the family's been ordered to stay indoors. Movement is increasingly restricted. Once every 3 days, one family member is allowed to leave the house to pick up groceries. Supplies and produce are limited. Shoppers stand in lines 1 meter apart, waiting to enter. It's been almost a month since Wang saw his daughters, who are staying with relatives in southeast China.
I feel relieved that my wife and daughters are not in Hubei now. We chat online every day. They're doing okay. Just worry about me.
The vast majority of confirmed coronavirus cases, more than 50,000, are in Hubei province. Patients have been sharing videos on social media of life inside makeshift hospitals and quarantine centers. At least 1,700 medical staff are among the infected. Elsewhere in China, people aren't taking any chances. Wang Xin hopes Hubei's leaders will learn their lesson from the outbreak.
At the beginning, nobody paid enough attention. Everyone thought it was under control until it was too late.
And looks forward to life under lockdown coming to an end. Katrina Yu, Al Jazeera, Beijing.
All right, let's bring in our guests. In Hong Kong, we have Dr. John Nichols, who's a clinical professor in pathology at the University of Hong Kong. He is also an expert in flu viruses from Oxford in the United Kingdom. We have Dr. Peter Drobak, who's a global health specialist and director of the University of Oxford's Scholl Centre for Social Entrepreneurship. And in Colchester in the UK as well, Dr. Sung Zhu, who's a reader in modern history at the University of Essex. Among research there is China's health system. Welcome to you all. Dr. Nichols, if I could start with you first of all, before we get into the nitty-gritty of the question in hand, let's just spend a little time with you and an assessment of where we're at with this virus. Are we really any nearer understanding where we are with this virus and its impact globally and in China? What kind of threat is it?
Well, that's a very long question, which is difficult to answer. But certainly now that in Hong Kong we've had the samples of the virus, we've been able to actually start growing it in the laboratory. And we're now able to actually infect normal human tissues in a culture system. So we actually see which part of the body this virus replicates, which will help us to determine where it may spread to. We're also looking to see within the coronaviruses where this virus will lie. We don't think it's nearly as severe as one like SARS or MERS, but the question is, how much more severe is it than the other circulating coronaviruses which are in the environment? So hopefully, from the laboratory point of view, we'll get a better idea about where this actual severity of this infection and this virus lies. In terms of what's happening across the border and in China, it's a very complex situation, but as you indicated, there's very similar similarities with SARS. Is that during the SARS outbreak in 2003, which unfortunately we were involved with, the number of healthcare workers becoming infected is a repeat of what we saw in the SARS outbreak, and that's a big concern because if you get sick healthcare workers, that will also impede on the ability for the healthcare system to manage.
But am I right in saying that this virus appears less lethal than the SARS virus, but more infectious?
That's right. You're totally right. Is that if you look at the overall mortality and morbidity, at this stage, it is much less lethal than the SARS or the MERS coronavirus. And that actually is sort of one of the things which we're trying to do here is to let the public be more aware that this is not going to be as severe in terms of mortality, because that's leading to a very high degree of anxiety on that. But certainly, it's causing a major concern about the impact of how this will affect the healthcare system on that.
Right, and one very quick final question on this. Viruses don't like heat, do they? So does that mean that this could be seasonal, as the seasons change, that this virus will disappear?
Well, this is not the $64 million, but almost the $64 billion question. If we look at the historical evidence, is that the seasonal coronaviruses, the milder ones, do have a seasonal influence. They tend to peak in the winter and they decrease in the summer. And so the hope is that this virus will do the same. In SARS, we saw that the outbreak stopped in about May or June. Could that have been due to the population being more aware and changes in social hygiene, or the weather? We severely hope that the weather will be an impediment for the virus. On the other hand, it means that it could mean that the virus could go down to the southern hemisphere, which would become much cooler.
There's a lot of unknowns at the moment. It's certainly very much here at the moment. Dr. Sung Ju, let's look at the situation in China itself and how it's been dealt with there. Has China done enough, in your opinion?
In my opinion, China has done enough. It depends which way you look at it. There is some, from the start, there was very little public health intervention, and how the crisis is being handled, it's largely political. So the approach was very authoritarian, and the measures which was introduced was largely to ensure social stability. For example, to control the narrative, to prevent the information, as the Chinese government said, to leak out all the rumors. So a lot of work which was carried out in China in the initial stage was to conceal the information. And
right.
Until...
So when we see now the sacking of officials, is this just scapegoating by the leadership, covering up what is or could be an overloaded health system?
It's both. Yeah, it's obviously the Chinese health care system. It's weak. It's overloaded, inefficient, expensive, and chaotic. the sack of the official, it's a scapegoating. It's a normal practice for communist authority to to not to be held accountable for its weak, inefficient healthcare system. So it was the people on the ground who were incapable of handling the crisis or their misdeeds, which led to the problem.
Right, Peter Drobak, it's easy to level criticism, isn't it? But isn't it a very difficult situation in dealing with an outbreak like this anyway? And then this virus itself is different because it can spread before symptoms show themselves.
Absolutely, and this is, of course, a new virus in the human population, and so we're still learning about the dynamics of how it spreads and how easily it spreads, and so there were so many and still really remain so many unknowns that it's very difficult to predict. And so obviously after a slow start, the response in China has been quite extraordinary in terms of the lengths that have been gone to isolate millions of people, to build field hospitals, and we don't yet know if those things will work, but it of course has been quite an aggressive response. And internationally, there have been promising signs of cooperation, and while the number of cases outside of China continue to rise, those numbers do remain small.
And the WHO, of course, the World Health Organization, they've extolled the virtues of China's response. What do you make of that?
Yeah, again, they've taken really unprecedented measures in terms of trying to control this outbreak. And I think at this time, what's really required is unprecedented sharing of information, transparency, and international cooperation. So we've seen China allowing experts internationally from WHO and elsewhere to come in and provide support where it's needed. Sharing of scientific information is incredibly important. You know, viruses don't respect borders. And so anything that suppresses the sharing of information or secrecy really favors the virus, and so cooperation is what we need.
And do you think the actions of the WHO itself are satisfactory? There's been a lot of criticism over the years. It's been building up about how the WHO operates, and the time has come for reforming its systems to handle emergency situations like this. Do you think it's pushed back on those criticisms by this response?
Yeah, I think the WHO's response or involvement has been appropriate and generally laudatory in helping to share information and to fight some of the epidemics of misinformation that we've seen, to promote cooperation and try to marshal resources. We need to remember is that WHO as a body is really more of a coordinating body and has very little power on its own to enact public health measures, but really to work with and influence countries on the ground to do so. And that I think they've been doing a nice job.
Dr. Nichols, we saw this big spike, this huge spike in reported cases in Hubei province on Thursday, and that's because the criteria for reporting the cases was changed. Just tell us a little bit more about that and what that means and what it means as to how we should interpret the figures that are coming out of China.
Okay, yeah. So basically what's changing is that before, the way in which they're trying to isolate the virus, there's two normal ways in which you detect if a person's got a virus. You either look for the virus itself using a thing called an antigen detection kit, where you're looking for components of the virus, or you're looking for the virus's genetic makeup using the RNA, if it's an RNA virus, using a thing called PCR. So right now, there's no rapid antigen test for detecting the coronavirus. So we're forced to use the PCR. And that is got a few problems with how you take the sample. And because also this stage, it's still unclear in which part of the respiratory tract the virus is replicating, then where you're taking the sample could lead to a bit of a problem. So the way in which you can change it is to actually try and get the more severe cases. So they're moving towards using chest x-rays, which will actually, so if the patient has then got clinical signs of a pneumonia, they can easily be brought in and then managed. So in a way, it's trying to triage the more severe cases who actually need admission and treatment. And also because this means that, because many more facilities have got chest x-rays and you can get a fast turnaround. And I think it's a good way in which you can actually get a good idea of what we call the denominator. Because right now, one of the unanswered questions about this virus if we talk about what's called the tip of the iceberg, is what we're seeing in Hubei or Wuhan, is this just the clinical severe cases? And there's a large proportion who only get very mild symptoms. So this is in a way to try and classify, to what degree of severity this virus is. But I think it was emphasized that this rise in the number of cases wasn't the number of people becoming sick, but actually the number of being classified with that. So in general, I think it's very appropriate when you have problems with the diagnostic kits, not enough kits, to actually use a tool which allows a better evaluation of who really needs to be admitted and treated.
Right, so they're kind of casting the net wider to a degree. Dr. Seung Ju.
Exactly, you're right. You're totally right. That's what it is. Yeah.
Right, Dr. Seung Ju. We've had this rash of announcement from the Chinese government today about improving the response to major diseases. We alluded to them earlier about how it's exposed loopholes and how the Chinese government will close these loopholes. And with this kind of disparity in figures that we heard about this week, do you trust the Chinese government to do what is necessary? Are you satisfied with the figures coming out of China?
I was going to say something about the Chinese statistics. From my experience working in the archive and look at the Chinese statistics, kind of to do with disease prevention, etc. And I would say the Chinese statistics are not reliable. I can tell you why. Because those ones, quite often on those people on the grassroots level, those ones who are responsible for collecting the statistics, the data, they are either they don't have enough time, they're overworked, or they don't have the capability. They just been called, kind of in especially with such a major outbreak with such a huge number. And lots of people being recruited to the work. They had no previous experience, and so the data they collected was unreliable. In that cases, in some cases, they simply didn't have time, so they just write down anything. And when this figure goes up to the next level, the experts or their superior, and they're supposed to verify those statistics, those data, but they have no means of doing it. So what they do is they massage the data to make it look like it's more or less right. Yeah. Then it goes to the next level, the provincial authority, then they don't want to kind of the figure to make them look bad. They want to show that they're in control of the situation. So, kind of over-reporting success or under-reporting, kind of failure or, kind of casualty. It's a normal practice.
Okay, well, there's certainly been a change in tone from the transparency that we saw in January, and it's now given way to the state media not touching on the negative and accentuating the positive. Dr. Droback, what do you make of this?
They're also turning this prevention into a moral crusade. Yeah, so kind of to reporting on the good stories, the success, the touching stories.
Right, and Dr. Droback, what's your view on this? So if it seems that we can't trust the data, that statistics are being massaged and changed, and in that case, it changes the whole parameters of how we deal with this.
Yeah, absolutely. I mean, it's important that we have as accurate data as possible, and suppressing any information if that's happening is obviously going to really hamper the response. WHO can play a role in validating some of those statistics. So I don't know if those reports are true. Obviously, that's very difficult.
Right, and in your view, is what's been this combined effort from the WHO and the Chinese government, is it enough to stop this epidemic spreading?
Well, I hope so, and time will tell. Again, it's difficult to understand the trends, both because we have some questions about the validity of the data, as has been pointed out, but also because this reclassification of cases over the last couple of days has caused a spike in the number of reported cases. So it's difficult to understand whether we are near a leveling off of cases or a tipping point or not. It appears that that's not the case yet, at least within the epicenter of the epidemic in Hubei province.
Dr. Nichols, I don't know if you want to come back on that, but I also want to ask you about moving it on to the prospect of a vaccine and where we are with that.
Okay, so I just want to follow up is that, I think that if we look more at the cases which are occurring outside mainland China, where you actually get, you have the people and the resources, I think that will probably be a better indicator of the actual disease severity and the natural history of this viral outbreak, rather than the overworked and the overloaded system across in mainland China. So that's why I think we should not be separating out, coronavirus cases worldwide, but look into those in actual regions. So that might give us a better idea of of what the true nature of this disease is. On the vaccine, I really think that those who think there can be a vaccine in about 6 months have been watching too much Hollywood, because in reality, to get a vaccine, you have to make sure that it works, is that it's got no side effects, and you have a disease model in an animals where you can test it, which shows that it's efficacious. The route of administration, can you scale it up, and the side effects. So I think the last thing which you want to do is be rushing a vaccine into a population and getting side effects, and then you get such a negative reaction like we saw in the Philippines with the outbreak of things like measles, which occurred after fears about one of the vaccines. So for this current outbreak, we really will not be able to have any hope for a vaccine. And the problem is also in the past, I think there's been limited success of coronavirus vaccines. With influenza, there's a long history of getting reliable vaccines. But with coronavirus, I think we're dealing with a totally new ballpark.
And Dr. Drobak, some school of thought that for every case that is reported, there's 7 or 8 more out there. Is that your view of how things work?
It's difficult to know for sure, again, because we're getting incomplete information from within China. I think, as Dr. Nichols suggested, outside of China, particularly in countries with more robust health systems, the numbers are likely much more accurate. I think it's probably fairly safe to assume that the overall number of cases is higher than what has been reported so far, particularly because of the number of mild cases that may go unrecorded. Whether that's 7 or 8 times or more or less than that, there are mathematical models, but I couldn't say.
Right. And Dr. Sung-Ju, within China, what are you hearing about the general response to how the government has handled this? Is there satisfaction? How will they come out at the end of all this?
Well, you mean people's response or the government's response? The
people's response. How did the population at large, how do they regard how the government has responded to this outbreak?
Well, people has been very divided. And some, there's a different reaction to this. And some, are on the same page with the government. They see this as a political undertake, and they see this as, China's rise. And they want to, be very much sort of being, united with government to fight the disease. And there's lots of people also don't trust both the political system and the health system. And there's lots of panic, sense of panic and fear, and obviously distrust. So which makes the prevention and control of the virus even more difficult. If people don't trust the system, if they don't trust the government, they are not less likely to do what they've been told to do.
Okay, very, very quickly, Dr. Nichols, I'm just going to jump in there. These outbreaks do appear pretty frequently in China. Coronavirus, SARS in 2003, bird flu, etc. In 30 seconds or so, can you just outline why that is?
It's because this is where you get a high population density near wild animals, and basically also you also have a almost like a rural economy very close to a built-up economy. So that allows the intermingling of viruses from one host to another. I think from the bats to an intermediate host to humans to be very, it's very likely. But having said that, even though Xi Jinping might be able to close down the wildlife markets in China, in Vietnam and in Indonesia, there's still going to be these small village-type markets where sanitation and infection control is not that high. And that's what we still get the avian influenza occurring, not in the major cities, but in the rural areas. So China may be able to stamp it out, but I think other Asian countries, it can still be a problem.
All right, well, we'll see how things develop. We run out of time. Dr. John Nichols, Dr. Sung Ju, and Dr. Peter Drebek, thanks very much indeed for joining us here on the programme. And thank you too for watching. You can see this programme again anytime by visiting our website, aljazeera.com. And for further discussion, just go to our Facebook page. That's facebook.com/AJ Inside Story. You can also join the conversation on Twitter. Our handle is @AJ Inside Story. From me, Nick Clark, and the whole team here, it's goodbye for now.
Reducing deaths, protecting health workers and developing a vaccine. Those are the priorities of the World Health Organization set out as we go on air after a 2-day meeting of health experts in Geneva. They put together a global call to action to tackle coronavirus, which they've now renamed COVID-19. Our health correspondent, Victoria McDonald, is in Geneva. And Victoria, we'll come back to that meeting in a minute. But first, if you could just bring us up to date on this breaking news about the first case in London, please.
Yes, we understand that it was a woman from mainland China who flew into Britain and who is currently on her way to St Thomas's Hospital in South London, where they have a specialist centre. That is as much as we know at the moment. It was always expected that we would get cases here, and the public health system is set up very well, so we're told, to be able to deal with this.
And now what about the WHO meeting that you've been listening into?
Yes, they've spent two days with more than 400 experts putting together a blueprint, a roadmap, so that they don't have any gaps. They want to know where the research should be. They want to know how they can prevent deaths, what sort of vaccines need to be developed. They say that they've got 4 vaccines that are potential, and maybe 2 of those might be in human trials within a few months, though not anything ready for maybe 18 months. What is critical is that they have put together this plan, because in the past there have been gaps. This is what the Director General had to say just now.
As we speak, research groups are meeting with the leading research funders to start work immediately on the most pressing questions. Some of these issues include easy-to-apply diagnostics, the best approach for infection prevention, potential therapies that could be used to treat patients, existing vaccine candidates and how to accelerate them, and how to address the epidemic.
You can see there are a number of questions that they have to answer, and there are numerous questions that are unanswered. Not least, why have there been no cases reported in India, Indonesia and Africa, all places where there is a lot of movement between China? So there are questions, queries, worries actually that there haven't been any reports. But this is how the day and the last 2 days have unfolded.
When they went into hospital, they were diagnosed with novel coronavirus pneumonia. Discharged yesterday, they are cured, and the disease is now called COVID-19. Not much else has changed, though. Experts still don't have the answers to some critical questions. How contagious the virus is? Can it spread without people showing symptoms? They're even unclear on the death rate. So scientists meeting at the World Health Organization in Geneva have developed a blueprint to help speed up the information they need and to develop medicines to vaccinate, treat and cure.
This meeting is a direct result of lessons learned during the West Africa Ebola outbreak, because while they were eventually able to develop a vaccine, they also found that they had huge gaps, particularly in research and development, and they don't want that to happen this time.
The blueprint outlines how to mobilize international action, produce a global research agenda, accelerate the development of medical products to control the outbreak, and increase the understanding of the disease.
I'm sure that everyone feels terrible that so many lives had to be lost in the West Africa Ebola outbreak before we could get our act together. We don't want to see that, and in fact even the deaths that are happening on a daily basis in China you can see that everyone feels bad about that and wants to do something to stop it. So it doesn't matter which country is affected. Somehow there seems to be now, at least in the scientific community, a desire that a global public good is something that's driving people.
Information from previous coronavirus outbreaks like SARS in the early 2000s means vaccine developers are not starting entirely from scratch.
People are dying as we speak or have already died, so it's never timely enough in an outbreak session. What I see, what I hear, what I feel, what I also feel myself, is that people are doing really the very best and beyond to be as quick as possible with the learnings from other outbreak situations in the past, like H1N1 or Ebola. This is being integrated so that things can go much quicker now.
Room service with a difference, protection suits, delivering food and temperature checks. This is a hotel in Hubei province currently in quarantine. The Chinese authorities are claiming that overall numbers of new cases of COVID-19 are falling.
The daily number of new confirmed cases dropped to 2,015 on Tuesday, from the peak of 3,887 recorded on February the 4th. The daily number of new suspected cases has also lowered.
But medical experts are cautious, saying there are too many gaps in the data to know how meaningful this is. And in Wuhan, the numbers remain overwhelming, with reports of the authorities requisitioning private hospitals, hotels, apartments, cars and even face masks. So far, more than 45,000 people have been diagnosed with COVID-19, and there have been 1,117 deaths. The numbers outside China remain tiny, but containment is everything, stopping its spread, while scientists seek the prevention and the cure.
Victoria McDonald reporting from Geneva there. So as we've heard, it's been revealed in the last hour that a woman who flew into London from China a few days ago is being treated for coronavirus, bringing the total number of UK cases to 9. She reportedly developed symptoms after landing at Heathrow and is now in a central London hospital. Meanwhile, health officials in Sussex say that they've traced all close contacts of 2 GPs who've been diagnosed with the illness. Several schools in the Brighton area have said that parents can choose to keep their children at home. Aisha Tal reports.
A community watching closely but calmly. In Worthing, in Brighton and Hove, people are taking precautions and asking for more information on COVID-19, known as the coronavirus. And here in Worthing, one of the 8 confirmed UK cases works in the A&E department of this hospital. And just outside, people are more aware of the virus than even yesterday.
Are you worried about it? Do you think do you get a sense that people are getting a bit more worried and a bit more panicked?
Getting a bit more worried, a bit more panicking, because every time anybody sneezes or coughs or anything else, they get a bit putting their hands up, putting their coats up over their mouths and everything else. But a lot of people have just got common colds.